All right, welcome back to DAYBREAK, and it's time we want to speak to the Governor of Nyandarua County by the name Francis Kimemia. Good morning, Governor.
Good morning.
Right, and
Good
let's
morning.
thank you so much for joining us on DAYBREAK. And let's begin with a question, because yesterday we saw a tour of the Cabinet Secretaries of Interior and Health coming to your county, and the announcement that your county is still COVID-19 free. There's some people that have been asking, what is it that you've done to ensure that you're COVID-19 free? Or is it a question of low capacity in terms of testing? Or in actual sense, there's nobody that has turned positive in that county?
No. The citizens have been very compliant in terms of adhering to the guidelines that were issued. Mm-hmm. Right from the beginning, Nyandarua people were not shy to put on masks. Mm-hmm. We bought about almost close to 8,000 tanks with the sanitizations, and all the border had tanks and soap. And then the public information sensitization has been very aggressive. Mm-hmm. So I think it has been the cooperation between the publics themselves with the county government, the national government instruction, what the president kept reminding us with the minister.
Right.
That has contributed. But we have been testing people. Okay. We have tested over 650,000 cases. And all of them, the ones we suspected, turned out to be negative. Mm-hmm. So far so good. Yeah. It doesn't mean that we're immune though, but we are so good.
Just to clarify, what figure did you say you've tested so far?
About 650,000.
650,000.
Yes.
Well, where? I'm having trouble with that figure, because nationally the tests have been 118,000. So how is that higher than, how is the Nyandarua's testing higher than the national? Well, we appear to be having some challenges with the signal of Governor of Nyandarua, Francis Kimemia. We're trying to reconnect with him to continue telling us about the situation of the state of preparedness in that county. Of course, he was indicating there that they have been doing testing, but so far nobody has tested positive in that county. Also hailing the residents of Nyandarua County that so far they've been able to put on masks and also observe the containment measures that have been announced by the national government, the Ministry of Health, in as far as social distancing, ensuring that you wash your hands, wear your masks, and also avoid social gatherings. So they've been obedient in as far as that is concerned. So as soon as we get the governor back, we'll be talking about that. But also a point to note so far is that every county has been asked to come up with a bed capacity of about 300 at the minimum, but also that should vary based on the situation with the population of different counties to be in a position to match that. So really, the governor yesterday, that is Francis Kimemia, said that the county government of Nyandarua is working to ensure that different institutions have been identified and the bed capacity identified to establish how many there are. But also there's the question of what these beds are supposed to be doing. The Cabinet Secretary and the Ministry of Health officials have been saying that these beds are not necessarily supposed to be hospital beds per se, because hospital beds have different considerations, but they are for isolation, because some people, or most people, actually more than 80%, sometimes last week or the week before, 87% of the patients of COVID-19 were symptomatic. And so the consideration here is that they do not essentially need hospitalization or hospital admission, and therefore those beds do not really have to have special considerations put in place, like for those that will be at hospitals. And so also we spoke to the Chief Executive Officer of the KMPDC, that is the Kenya Medical Practitioners and Dentists Council, Daniel Yumbe, indicating that by the next 2 weeks there should be a bed capacity of more than 6,900 across the country. But also what we know is that so far the capacity is at 1,450 across the country. So we have the governor back, Governor Francis Kimemia. Sorry about that, but you were telling me about the testing, and I was contrasting the figures that you're telling us about with the national figures of about 118,000. Specifically, how many people have been tested for coronavirus in Nyandarua?
117.
All right, 100. Okay, 117, and nobody has tested positive. So let's talk about the preparedness of the county governor. And yesterday you were saying that you're going to identify institutions where you should establish 300 bed capacity. Specifically, what are these considerations you're looking at to ensure that you're well prepared?
looking at equipment, because we must have, of course, the beds, the wards themselves, because we don't want to mix people with those who are not sick. I think one thing you have to make sure is to don't get a unit and put in patients in a ward and then you infect the entire hospital. Because these units have to be within the proximity of a hospital. So we have identified separated wards, or wards that are separate from the hospitals, where you can be able to put in, and they scatter to about 5 centers, 5 health centers in Guinea. We have Okanao, we have some in Nyandarua, some in Kinagop, and totaling 310 cases. Of the 300 that we are supposed to put in, we have been able to identify 310 bed spaces, so that we can be able to put those people. But the biggest risk is to put in people, then you infect either the entire hospital, and that's what the precautions we have been able to put up. We have PPEs. We already bought PPEs worth 24 million. Yesterday we got a grant from the national government with Honorable Kagwe of 1,000 PPEs that already in the country. So we have stock.
Right.
And these ones are usable. From what we are told, these ones are usable.
Okay.
So the issues of drugs, we have also been able to put in about 240 million to also make sure the drugs are in constant supply, just in case we require to get some backups. Yes.
And also, of course, we know that counties have started receiving the 5 billion shillings that was allocated to boost capacity.
Yes.
I don't know what your figure is and what priorities are you looking at?
My figures were 89 million. But as I've said, I'd already supplemented 240 million shillings, even as a county itself. Because we could not have waited until we get money from Nairobi. We had to, cushion our people, make sure that our people are safe with or without money coming from outside. So we'll be able now to balance our equations. We intend to, we are very weak on laboratories. We want to see whether we can beef up a laboratory center. And so that we have the 250, we have these 88, we can come up with a center that can be able to handle cases like this in future, in terms of labs, in terms of tests. It's kind of a COVID center or an infection center. That would be very, very, very impactful for the county.
And Governor, what are the timelines you're looking at? Because the financial year expires in about 14 days now. Yes.
When we're looking at 1 month, since the resources are still with us in the county, county resources don't go back anywhere. They'll still be within the county. So we can be able to commit the money before the financial year ends, and be able to make sure that we don't get our people into suffering. Or you can also have the money into emergency fund and be able to use it as quickly as possible, because it's an emergency. So you can't lose out lives of your people because of bureaucracies or financial bureaucracies. But that we have been able to circumvent. Yes.
All right. And Governor, you'll agree with me that the coronavirus pandemic has really exposed the delicate nature of the health sector in the country, and Nyandarua County is one of those. I heard you yesterday detailing some of the concerns and challenges that you face. So how do you think this situation can be used to the advantage of your county to boost the capacity of laboratories and also the hospitals that you have in that area to contain other issues, not just the pandemic?
Yes, we for example, we have lots of problems with people who suffer from non-communicable disease. Things like diabetes, the cancer patients, who can now go to India or to other countries. It has really brought out the real issues, the real life issues in people, whether they are diabetics, kidney patients, heart patients. We suffer a lot from URTI, upper respiratory tract infections, and of course arthritis because of cold. We have seen ourselves now requiring to rethink the entire medical strategy in the county afresh. And that's why we get this money, the money that we are getting from national government, the 89, close to 90 million shillings. We are thinking, what can we do long term to be able to sustain any future pandemic that comes, or serious infection or attack that comes to the county. And I believe that's what, even as governors, we are doing in the block, in the central block, which I chair, and also other governors in the country. So it has allowed us to review our medical strategy completely, revamp some dispensaries, revamp some health centers, revamp. At least we want to have JM Hospital in the county become level 5 and level 6, and a teaching referral hospital. And we agreed with the minister yesterday that we also upgrade Engineer Hospital to level 5 and some of the health centers will move to level 4, so that the county is able to. We have done a scan, a SWOT analysis, and we have seen we are quite weak on the medical issues, and we need to. This COVID has brought in those opportunities and those possibilities that we need to look at as a county.
And I mean, your term expires in about 2 months before you can seek for re-election. I don't know whether you're interested, but what timelines are you looking at? Because all these challenges are many, they require resources. You may not have the resources because priorities now have changed.
Yes. Is it 2 years or 2 months?
No, I mean 2 years, not 2 months.
Yes, we have done quite. We have, as of now, put in 13 health centers in the county, or health facilities in the county. But in addition, we have already put in money to upgrade JM Hospital, which is said to be level 4, but I was telling the minister it's somewhere between 3.5 and level 4. It's not really. So we have already put in money as a county. As a county, we have put in close to 300 million shillings to start a complex in the hospital that can have modern theaters, modern kitchens, modern labs. So diseases that are prevalent in the county, like the ones I've mentioned, can be treated in the county. We are partnering with Nyandarua University to see whether we can procure 50 million equipment that can be able to scan cancer and send to Nyandarua University, and you're able to diagnose cancer from within the county. You don't have to send people to India. These are some of the initiatives we are putting up for our people, with or without 2022. I think it will be very, very, very cheap to work on your people just because you want to be re-elected. I think you should work comprehensively for your people to become better than you found them. Yes, and I think those initiatives have been put in place. We want to make sure that health facilities are within a radius of 5 kilometers across the county, and gradually in the health facilities, we have procured equipment to be able to make more travelability easy. You see, you can also bring hospitals close just because the roads are very bad. But once you also improve the road network, it means with 5 kilometers you can be able to rush either with a border, with a vehicle, with a taxi to hospital, and be able to walk and back. So the other attendant infrastructure that has really compounded our case, lack of adequate power, which we are working on with the national government, with the president, lack of adequate transport facility, equipment for transportation, for constructing road network. You saw us launch it worth 500 million shillings. And yesterday I got a boost of 150 million shillings to put in an extra unit. We have 5 units, so we'll have 6 units in the county to be able to bring the roads to more trouble status in the county. One of the biggest challenges in Nyandarua County, following the historic issues and marginalization, has been lack of proper road network. We only have 250 kilometers of tarmac, and just about 40% connected to power and 40% connected to water. These are key infrastructure things I've embarked on, and we want to reduce this number to 70%, power and water, by 2022, so that people at least are able to move on. But roads, network, the 7,400 kilometers, we are embarking on 3,000 kilometers to make sure they're properly, and everybody can move to the nearest health center, nearest school, nearest market, nearest facility or institution that they want to move in. And that will be a big game changer for the county.
Right, and it appears that the priorities for your county have remained consistent, because the last time we spoke on this program, you were highlighting some of those. But now moving forward, as we wind up, Governor, so the coronavirus pandemic has affected the economy of the country and even the world, and I would imagine that the residents of Nyandarua are also affected. So how are you doing to ensure that you mitigate the effects, and especially to the most vulnerable and those that may have lost their jobs at such a time?
Very good question. We have said that we will not wait to develop the so-called post-COVID stimulus packages. We are already working on a stimulus packages. We have a trend fund we want to liberalize. Initially, we thought we would only give up to possibly 30,000 shillings per person. We want to liberalize that fund, a trend fund, and we want to boost it so that we can, the small business people, those who are selling mandazi, selling eggs, selling vegetable, bananas, charcoal, the small business people who have literally been brought down can be able to start off the economic activities, even as COVID is attacked, because we don't know how long it will take. We are told August will peak. We are just about to start thinking about opening up the economy and churches. These are things that we have looked at. We also have discovered that in spite of being a food surplus county, a food basket, we did on potatoes number 1, milk number 2, vegetables, number one, and many other, for horticulture and so on. But we realize we have pockets of poverty, the colonial villages.
Right.
That 5 of them, IPs that are settled here, people who are sleeping hungry, even in spite of the surpluses around, because you need to mobilize resources internally and without to feed those who cannot feed themselves. So we have put in a budget of that 3 million shillings to support those who cannot feed themselves. Some are from outside the county, work in the far farms. So there are many challenges that have come up. Not only medical, but also social dimensions type.
All right.
That we require to also address as we tackle the coronavirus. But to keep the economy running, if we open up the economy, make sure we don't open up the infection, or we continue putting those who are supposed to be quarantined into quarantine. We have more than 10,000 beds for quarantining. We have 13 ICU beds that we have already put in place. As of now, they'll be commissioning in the next 2 weeks. And almost 300 staff have been recruited to tackle coronavirus. The shortages in the medical facilities has been addressed. And as I've said, we are giving free water. We are giving licenses have been suspended for now. We are providing. We want to provide free medicine for cancer.
Governor, allow me to cut you short because you're practically running out of time. Thank you so much for giving us that update on the preparedness of Nyandarua County. And wish you all the best, even as you talk about 36 million shillings that has been allocated for the vulnerable people. Now